statements
My
and the apology.
Sorry, Your Honor. Dr. White, my question is the level of sedation that took place in those prior weeks. You're coming in here as an expert giving your opinion. I'm asking you, what level of sedation do you think Michael Jackson was being put under all those previous nights?
I would speculate, because I don't know, that it was possibly minimal to moderate sedation. Certainly more than 25 milligrams given over 3 to 5 minutes, yes. By moderate sedation.
What is monitored anesthesia care?
Monitored anesthesia care refers to a situation in which patients are monitored during a surgical or diagnostic procedure.
Or therapeutic, right?
Diagnostic or therapeutic procedure, correct. During which local anesthesia or some other analgesic drugs are typically administered, and the patient is often but not always provided levels of sedation that may vary from minimal sedation to very deep sedation, utilizing drugs such as propofol, midazolam, and other similar sedative compounds.
And as you said, that type of monitored anesthesia care is instituted sometimes in minimal sedation scenarios.
Correct.
You wrote an article entitled, or I think you were a co-author of an article entitled "The Changing Role of Monitored Anesthesia Care in the Ambulatory Setting."
Yes, I wrote that article along with
that
one of my
means-
fellows.
An ambulatory setting means what?
That means outpatient. It can be either in a center apart from a hospital or in a setting within a hospital environment.
You know, I have a quotation taken from the disreferenced manuscript. May that be marked Peoples 230 for identification?
It is. It'll be shown to Mr. Flanagan, please.
Dr. White, showing you what's been marked. Peoples 230 for identification. Can you see that from where you're seated, Dr. White?
Yes, I can. Yes, I can.
And you agree that's taken from your manuscript entitled "The Changing Role of Monitored Anesthesia Care in the Ambulatory Setting"?
It looks like it is. I don't recognize it because it's out of the context of the paper, but I'm assuming. Sure.
Just one moment.
I think it was written about a number of years ago, so.
Take a moment, please.
Your Honor, I have a copy of the article entitled "The Changing Role of Monitored Anesthesia Care in the Ambulatory Setting." May this be marked People's 231 for identification?
I'm unclear. What's 230 then?
That's a quotation from the article. Dr. White asked to see the actual article.
Well, is it necessary to mark the whole article if you're just focusing on a particular quotation? I think you show it to Dr. White and then we go from there. I'd rather not mark anything more.
May I approach the witness, Your Honor?
Sure. So we have 230, which is a segment.
And Dr. White, it's referencing, I believe it's page 1021. I could point you to the area if you like. Just following therefore.
Can I read the preceding sentence too, since it's a part
Sure.
of one paragraph? It just
Sure.
says the policy of the ASA, which is the American Society of Anesthesiologists, states that the same standard of care should be provided by an anesthesia practitioner during monitored anesthesia care, or MAC, as for general or regional anesthesia. Therefore, and then
And could you continue, please?
therefore, the provisions of MAC should include, as stated up on the
Could you, if you don't mind, could you
Sure.
just read it, please?
I'm happy to read it. Including a preoperative evaluation. This assumes the patient's undergoing a surgical procedure, obviously. Prescription of an anesthetic care plan, because you're giving anesthesia. The continuous presence of a member of the anesthesia care team, with the proximate presence and immediate availability of an anesthesiologist for the management of emergencies. The standards of monitoring include the usual cardiovascular and respiratory monitoring required for general anesthesia, namely electrocardiogram, blood pressure cuff, pulse oximeter, end-tidal carbon dioxide. In addition to patient monitoring, the anesthesia provider should be ready to administer oxygen, IV sedatives, tranquilizers, opioid and non-opioid analgesics, beta blockers, vasopressors, bronchodilators, antihypertensives, or other pharmacologic therapies so that the desired level of sedation, amnesia, anxiolysis, and analgesia can be achieved without compromising cardiorespiratory function or delaying recovery. You want me to read on, or is that?
No, thank you, doctor. And would you agree that traditionally benzodiazepines have actually been the most widely used drugs for sedation during MAC?
Prior to the introduction of propofol and the early studies that I described, that's correct.
And would you agree that even drugs such as midazolam, which is a benzodiazepine, right?
Correct.
Even drugs such as midazolam can produce prolonged residual sedation, and the resultant psychomotor impairment can delay recovery.
Yes, when given in large and sufficient doses, the effects and the duration of effects are dependent on the dose and the time frame over which they're administered.
What is meant by psychomotor impairment when reference is made to the effects of midazolam?
Those are fine motor skills, and we use various psychometric tests to quantify the duration of impairment. So they're very sensitive and also involving manual dexterity maneuvers and also cognitive functioning, matching numbers and symbols and various combinations. So they're varying levels of sophistication.
Are the standards for basic monitoring during MAC by anesthesiologists the same as those for general anesthesia?
Yes.
And that would include evaluations of oxygenation, ventilation, circulation, body temperature, and the continuous presence of qualified anesthesia personnel?
I'm not sure about body temperature. I'm not sure that that's routinely and always done, but yes, I generally agree.
You know, I have a quotation from the same manuscript in which Paul White's a co-author. May this be marked Peoples 231.
It is.
Dr. White's showing you Peoples 231, and I believe it's on page 1029 of the article.
Okay, I found it.
Okay. And you see that's your article, and it references these include evaluations of oxygenation, ventilation, circulation, and body temperature, and the continuous presence of qualified anesthesia personnel, correct?
Correct. Exactly.
What is, and I may mispronounce it, what is anxiolysis?
Anxiolysis is another term for reduction in anxiety level or blocking of anxiety.
And based on the defense quadruple G, that would involve minimal sedation, correct? Anxiolysis?
Well, anxiolysis is also part of monitored anesthesia care or conscious to deeper sedation as well.
As well, but it
Yeah.
would also include minimal sedation based on the continuum of sedation?
Correct.
I have another quotation, Your Honor, from the same manuscript. May this be marked Peoples 232 for identification.
Yes.
And Dr. White, I believe this is on page 1032.
Okay.
Now, this is discussing some of the requirements or parameters of MAC, monitored anesthesia care, correct?
Yes, it is.
And it puts in discussing anxiolysis, for example, with just midazolam, even that would fall under the purview of MAC, correct, based on the quotation from your article?
Well, if there's a procedure being conducted and an anesthesiologist is billing for anesthesia services, that is correct, even if no drug is administered and they're simply monitoring the patient during a surgical or diagnostic procedure. That is correct.
So in this situation, MAC level of care, MAC level of monitoring would be in place for a procedure that's pain-free, and anxiolysis is the main consideration, right? Based on your quotation from your article?
As I mentioned, yes, assuming there's a procedure being performed of some nature that would justify having anesthesia services provided.
Where you're saying if just propofol is being provided in the absence of a procedure, then you need less care?
I don't think that's what I said.
Okay. I have another quotation, Your Honor. May this be marked Peoples 233 for identification.
Yes.
And Dr. White, this is actually from, I believe you edited a textbook that Mr. Flanagan had referenced.
I've edited several textbooks.
Textbook of intravenous anesthesia.
Yes, I have. I did edit that textbook, correct.
And showing you Peoples 233. Can you read that out loud and tell me if that's a quotation from your article on propofol?
I don't have the textbook before me, but if you say it's from the textbook, I'll
No, that's okay.
trust.
That's okay. If you want to see it in the textbook.
Well, you're asking me if it's a correct quote, and it's not that I suggest you would do anything other than
May I
quote it
approach the
correctly.
witness, Your Honor?
You may.
I'm going to reference you to your own article on propofol on page 119. And you see where I'm pointing here?
Yeah.
Is that an accurate quotation from your article?
It's not completely accurate. Do you see